Hello guys. So, did you know that many people around the world they complain of severe chest pain, severe chest discomfort and shortness of breath. So, are you able to identify which heart disease they are suffering from? Are they suffering from cardiac arrest or are they suffering from a heart attack? Are you able to distinguish between these two diseases? Many people or many students around the world are unable to distinguish between what is heart attack and what is cardiac arrest, as both are completely different heart diseases. So let's learn what is the basic difference between heart attack and cardiac arrest. Now, what happens during heart attack? During heart attack, the blood supply to your heart is blocked. Now, which arteries are responsible to supply blood to your heart? Coronary arteries, right? The coronary arteries are blocked. Now, what happens and why are these coronary arteries blocked? This happens due to this plaque formation which takes place in your arteries. This plaque is the fatty deposits which accumulate inside your arteries. What happens when they start to accumulate in your arteries? They block the pathway of your arteries for the supply of blood to the heart. Now, when the blood supply to the heart is blocked, your heart does not get enough supply of blood, and this is called as heart attack. The reduced blood flow to the artery and eventually to your heart is called the heart attack. Now, this fatty deposits are called the plaque formation which takes place inside your arteries, right? And these also start to rupture, they also start to rupture the walls of the arteries, and this is called coronary artery spasms, right? This coronary artery spasms in when the walls of your arteries are started to rupture, they start to wear off, they start to break, due which your arteries are damaged and the heart does not get enough blood supply. Also, there are small blood clots which also accumulate inside your arteries, right? Let me just explain. If this is your artery, right, these small blood clots start to form inside your arteries, due to which they block the pathway for the blood supply to travel to the heart, due to which you suffer from heart attack. Now, if a person is suffering from heart attack, what happens? What are the symptoms? Okay, now here is the main difference, right? Many people considered chest pain, chest discomfort, and heaviness in the chest and squeezing inside your chest. You feel as if your chest is very, very tightened and severe squeezing takes place in your chest. This is considered as heart attack. Chest pain is the symptom of both cardiac arrest and heart attack, right? So you cannot distinguish if you're having chest pain. You cannot distinguish if you are suffering from heart attack or cardiac arrest. You have to monitor other symptoms as well. If you are suffering from severe squeezing, severe heaviness in your chest, shortness of breath, you are suffering from a heart attack, right? You will feel tired, sweating will be experienced inside your body. You will feel dizziness. You will face blurred vision. You will not be able to see things properly. You will feel dizziness. You will not be able to open your eyes. That is called heart attack. So what is cardiac arrest then? Okay, if you are understood heart attack, now we are discussing what is cardiac arrest. Cardiac arrest is when your heart suddenly stops to beat, right? Your heart suddenly stops to beat. Either your heart suddenly stops to beat or your heart beats extremely fast, and this happens due to abnormal rhythm in your heart. We know that heart does not require any stimulus or other any other triggerness for contraction and relaxation. We know that heart generates its own electrical impulses for contraction and relaxation. So when these impulses are abnormal, because these impulses are in a synchronized way, when these impulses are abnormal rhythm is taking place. This is called arrhythmia, right? Abnormal electrical rhythm, abnormal electrical signals are being produced inside your heart. This is called cardiac arrest. So now have you understood what is actually the difference between heart attack and cardiac arrest? There's a huge difference between heart attack and cardiac arrest, right? Your heart stops beating, or your heart beats extremely fast, right? So this the key point to remember here is your heart stops pumping blood because it's not beating. It won't pump blood to your body, so your vital organs will be affected. Your vital organs will stop functioning, and eventually you have to go to emergency because this cannot be treated at home. Of course, you have to call the respected emergency numbers wherever you live and wherever area you are living in. You call the respected emergency numbers, right? So what are the causes of cardiac arrest then, right? So the cause of cardiac arrest, the main cause, as I've told you, is abnormal heart rhythm, right? Or for some kind of coronary artery disease, you are suffering from any kind of infection or injuries, or if it's in your genetics, you can face cardiac arrest, right? So cardiac arrest, main point to remember, your heart beats rapidly or either it stops beating, right? So you have to instantly go to the emergency, right? What is the symptom? Now symptoms are very different. Shortness of breath and chest discomfort are the similar symptoms of both heart attack and cardiac arrest. But what is the key difference, and what is the key symptom of cardiac arrest? You will suddenly collapse. The person will suddenly fall, and they will be unconscious. They won't respond properly, right? That is the main symptom of cardiac arrest. Irregular heartbeat, the person will experience irregular heartbeat. If you check that patient, you will feel that they will be having abnormal or irregular heartbeat, right? Now, what are the risk factors of both of these diseases? So risk factors is if you have history, if you are diabetic, if your blood pressures are very high, if you're smoking, if you have cholesterol issues, you will face heart attack. And if you, how will you what are the risk factors of cardiac arrest? If you are suffering from any kind of heart failure, inflammation in your heart, or heart valve disease, if your heart valves are not functioning properly, or if your heart muscles are extremely thickened, hypertrophy, right? Hypertrophy is a pathological condition, right? If your heart muscles are very thickened, you can experience cardiac arrest. Now, what are the complications of heart attack? And what are the complications of cardiac arrest? What can you experience if you have gone through a heart attack? Arrhythmias, of course. Cardiogenic shock. Cardiogenic shock is your heart cannot send enough blood to the body, right? Your body will be receiving minimum amount of blood, or you can also you will also suffer from heart failure, right? Pumping, right? Pumping of blood will reduce, right? And what are the complications of cardiac arrest? What are you will face heart issues, right? Kidney level problem you will experience, right? Memory problems, swallowing problems. So these are the small things which you will experience. Now, last thing, the treatment, right? The treatment, you know that there is some percutaneous coronary intervention for heart attack, that which we call stunts or angioplasty. um, I will not go into that much detail for that because that is not part of the that is very detailed and we cannot uh, discuss it in a very short time. However, percutaneous coronary intervention is a small catheter you will inject inside, and a tiny balloon to clear the blockage inside your heart, right? That's angioplasty or stenting, right? Stunt, you might have heard about that. The person who suffers from heart attack they get stunts or angioplasty done, right? And second test is second treatment is coronary artery bypass, right? We inject or we introduce a new blood vessel inside your heart, right? Fibrinolytical therapy and medications include anticoagulants, beta blockers, ACE inhibitors to lower the BP, right? Antiarrhythmic drugs to reduce the abnormal rhythms in your heart, beta blockers to decrease the heart rate, and nitroglycerin to relieve the chest pain. The main medication is actually the ACE inhibitor, the ARBs, first of all to lower that BP, and add anti-arrhythmic drugs, right? So that is actually the treatment for heart attack. Now, what is the treatment for cardiac arrest? So first of all, you need to get your blood test done, and secondly, echocardiogram. Echocardiogram is basically a test in which you observe how well your heart is squeezing blood and how well your heart is pumping that blood, right? Coronary angiogram. Coronary angiogram again to see how your heart is performing, right? And genetic test, right? So that is the diagnosis for cardiac arrest. And what is the treatment? CPR, you will provide CPR. CPR is basically CPR is a very common thing which you might have heard about. CPR is basically a life-saving procedure in which you rescue the breathe. You are trying to actually restore if a person is not, if you observe that a person is not breathing, or the chest compression to compress that, compress the chest of that patient to see if there's any blockage, or to remove any blockage, or to restore the abnormal rhythm. We also we perform CPR, and CPR also includes AED. AED is basically automated external defibrillator, which we considered as shocks. You might have heard about that patients are given shocks if their heartbeat is not normal, or there's no heartbeat. So basically we give them shocks to restore if any abnormal rhythm has taken place, to remove that abnormal rhythm and restore the normal heartbeat. So we consider the AED in very serious conditions, right? And medications are commonly used, right? For diagnosis of heart attack, we do ECG, right? ECG is to basically observe the heart's electrical signals, and um, what are the electrical signals, for if there are any abnormal electrical signals, you can observe in that. Troponin test and CT scan. Troponin test is basically if your heart is not functioning properly during a heart attack, you will see that CTN troponins will appear in your blood, right? So that will indicate that you've suffered from a heart attack. CT scan, MRI is also performed on regular basis to check the activity of your heart, right? So we have discussed the main difference between cardiac arrest and heart attack. So I hope you will not confuse between heart attack and cardiac arrest, as they both are different diseases. They both are very different diseases. They are not same. Their symptoms are similar, but they are not same. Okay. For example, if I discuss high blood pressure, right? I discussed here that high blood pressure can cause heart attack. So if you have not seen my previous videos on high blood pressure, hypertension, and hypotension, please go and head over to that video to understand what is the basic difference between hypertension and hypotension. Thank you for watching this video. Like, subscribe, and share, and do let me know in the comments what are the other topics which you find difficult. Thank you.